Okay. So what I've been asked to talk about is communicating with your loved ones about your pituitary condition. Um, so that's the plan. That's the aim for the session. Oops, come on, you clicking. There we go. So the outline for the session, there's a short section about just some basics about communication. I thought it'd be useful to think about some of the difficulties associated with having a chronic condition, because they're the things that actually make it difficult to talk to families or family members. So I'm going to talk a little bit about what happens when we get a chronic condition and the impact of that. And there's some suggestions for strategies you can try for communicating with loved ones, and then hopefully I will stop in a timely fashion and there'll be time for Q&A. So we start with the kind of nuts and bolts. Communication is useful for a number of things. We communicate with each other to share ideas, to explain what it is we want, what we need, how we're feeling. We communicate to work out differences, to come to some kind of mutually agreed way of moving forward, and also to express our feelings. And it's an important skill to be able to relate to other people effectively. So communication is actually not so much what you say, it's actually more important how you say it. So 60% of what we communicate is actually via body language. So that includes gestures, facial expressions, body movements, etc. A third of what we communicate is actually by tone of voice, and at 7%, the actual content that sounds really, really low. I guess one way of thinking about it is there's a world of difference between having someone get in your face and shout at you, or having them sit next to you and give you the same information quietly. So the content of the information could be the same, but the body language and the tone of voice could be very, very different. And when someone is very angry or anxious, sometimes their body language, their tone of voice can kind of put other people off. They find it quite difficult to engage with. So it's not all about what we say, although what we say does matter. In most communication research is done in what we call dyads, which is a really posh word for two people. I love that. So in most communication, you've got a sender, as in the person who's doing the talking, and a receiver, as in the person who's listening. And in most normal conversations, so like over coffee or something like that, we take turns in being both the sender and the receiver. But there's an odd thing that happens. So during a normal conversation, over tea or coffee, when we talk to someone else, and actually listen to what it is they're saying. Remember, most of the communication is done by body language and tone of voice. So what you're actually doing is your brain is scanning the body language and the tone of voice, and it's kind of listening out for keywords. And in your head, what's happening is you're preparing what you're going to say when they stop talking. Although in some cases, if you get overexcited, you're preparing what you're going to say before they stop talking. So you'll jump on the end of their sentence. So that's a normal conversation over tea or coffee. And the kind of conversations that I have, as a professional psychologist, I teach professional skills. And one of the things I teach is how to have non-normal conversations, which is where we still take turns being sender and receiver. But the person listening is actually properly paying attention. They are not preparing what they're going to say in their head when you stop talking. So if you see a counsellor, for example, you might tell them something and then there might be a pause because they need to think about what you've just said. So they need to properly consider it. And so in those kinds of conversations, the speed of the conversation actually, it slows right down because they need to be sure they're understanding what it is you're trying to convey, what it is you're trying to say. So hopefully that makes sense. If we move on to well, why is it difficult? Because that sounds really kind of like straightforward. So what's difficult? Why is it so hard to talk to family members? If we start out by thinking about what happens when we get sick. So in our society, we are more used to people having acute conditions. So the examples we've got there is someone in bed with flu and someone with a broken leg. So acute conditions, things that you're ill with for a while and then you get better. And so back in the 1970s, there was a psychologist called Parsons, and he did some research looking at what happens when people get sick. And he realized that there's this set of behaviors that we expect when someone takes on what he dubbed the sick role. And so when someone's not well, we expect them to not do their normal daily activities. So you might have come across someone, you might have heard it in your workplace or somewhere else, and someone says, oh, I feel like I've got flu. And someone else would say to them, if you really had flu, you wouldn't be here. Because there's an expectation about how flu manifests itself. So if someone's up and about doing their daily activities, they can't possibly have flu. So if you have flu, you're not supposed to be doing your daily, you're supposed to be prone on a bed somewhere under a duvet, because it's too difficult to get up. You have to have symptoms that are recognized by other people. So there's a constellation of symptoms that we say, yes, if you've got fever and you're going hot and cold and you're feeling like you've been run over by a steamroller, you've got lots of aches and pains, you can barely get out of bed, yes, you've definitely got flu. You may be coughing and spluttering and head bunged up, etc. But we have symptoms that we can go, yes, those are flu symptoms. And if you've got a broken limb, then we know what the signs and symptoms are of that. If you are not well with an acute condition, there is an expectation that you're going to want to get better. You are not going to want to stay in bed with flu or COVID or a cold or whatever it might be. The idea is that you would take steps in order to get better. If necessary, you would seek appropriate professional help, whether that's GP, pharmacist, whatever. And you would follow advice and instructions. So if your GP tells you you need to stay at home, then the expectation is you would follow that advice. You'd get a sick note so that you don't have to go to work. And we also expect that acute conditions are time limited. So there is an expectation that once you're well again, you will go back, you will return to your normal activities of daily living, whatever those might be, at some point. And that's the experience of sickness that most of us have. That's the one that's kind of within our society. That's the one that we kind of expect. Problem is, it's not like that if you have a chronic health condition, but we don't, as a society, have a good understanding of what and how a chronic condition is different. And so you have someone who say, oh, I've got a pituitary condition, or I've got a chronic condition, and this is what pops into their head. But actually, it's not like that. So what is it like then? So for chronic conditions, what seems to happen, you've got two different pathways here. Okay, so you've got linear on the left. That just means it's a straight line. So you experience some symptoms of whatever pituitary condition or other chronic condition. There'll be some form of testing and a diagnostic process to go through. You may well need to have for a lot of the pituitary conditions, you may well need to have surgery or radiotherapy or indeed other major interventions. And for each of those, there will be post-op recovery periods. And then you may get some late effects because of the hormone replacements that you're getting. So you may still have some signs and symptoms because of the adjustment to the hormones. But for some people, I don't see very many of them. I'm a psychologist, so I tend to see the people who are having difficulties. But I am reliably informed by my endocrine colleagues that there are some people for whom it is actually very straightforward and it is basically linear. You go through the steps in a neat and tidy fashion, although for chronic conditions, it's not a quick process. So we're talking months. Whereas with an acute condition, flu, it's like 2 weeks in bed feeling horrible and 2 weeks feeling up and about, but feeling like you've been wrung out like a dish rag. but then you should be pretty much back to normal. With these kinds of chronic conditions, we're looking at 18 months potentially to get to a point where if it's all gone straightforwardly, you should be pretty much stable again, but there will probably still be some fluctuations after that. However, for other individuals, it's very circular. It's almost like they're going round and round in circles. So you get some symptoms, have testing and diagnosis, you have surgery. For some conditions, say for Cushing's, for example, the Cushing surgery may not be effective first time. So you go through post-op recovery, you get some late effects, and then you start getting symptoms again, and you just keep going round and round and round. Cushing's is one of the pituitary conditions that can and is known to recur. And so it's quite common for it to be circular, for it to go round and round in circles. And that can go on for years and years and years. And that is totally counter to the acute experience of illness that we're used to in our society. And so people find it very confusing. They don't understand why, if you have a chronic condition, why haven't you just kind of like had the treatment, and why are you not now better? What's going on? Why is this still a thing? So people find that, and actually the patients themselves also find it quite challenging. You know, it's not just family members and such and ordinary members of the public who've never heard of pituitary conditions. It's kind of it's a difficult thing for everyone. So I've labelled this slide chronic illness behaviour. So kind of thinking about it in two stages. The first stage where we have a chronic illness is having some sense of understanding what's happening, what's going on. And so on the left, you've got these two boxes. The first one is the representation of the health threat. So what does it mean that I have got a pituitary tumour? How does this change my identity? How does this challenge my identity? So with acute illness, we get sick and then we get better again, but we don't change as individuals. With some of the pituitary conditions, though, they can change the way that you look, they can change the way you think and feel. And so it can feel like your identity is under threat. What's caused it? So sometimes people want to know why they have got a pituitary tumour. Was it something that they've done? Was it a mistake they've made at some point? Is there some blame to be attributed somewhere? Is it genetic? And so there can be a lot of questions around that. What might be the consequences of having this condition? Is it going to be straightforward, or am I going to be going round and round in circles? What's the timeline? So because it's not acute, we're talking months and years potentially. For pituitary conditions and chronic conditions, it's not necessarily about cure, it's actually about control and treatment, and that's a very different thing. You know, you can cure a flu, you get over it, but that's not how it works with pituitary conditions. And then there's the emotional reaction to that health threat, and that can be fear and anxiety. You can also get some individuals reacting with anger. They're kind of, why me? Why is this happening? It's not fair, which is entirely logical questions and entirely logical feelings to be having. And also lowered mood or depression, kind of feelings of sadness that this is happening, particularly if the kind of knock-on consequences, say maybe affected fertility, might be a consequence of the particular pituitary condition you've got, and the emotional reaction to that can be very significant. So the first stage is understanding what's happening and having an emotional reaction to that. And then stage two, we kind of talk about coping and how do we cope. And there are different coping mechanisms. So some individuals do what we call emotion-based coping. So it's led very much by how they're feeling. That's what they focus on, and they try and do things that will make them feel better. Problem-based coping is where we're looking at things more in a practical fashion. So if I'm having difficulties at work, what kinds of adjustments do I need to have made? What kind of problems are there that need solving? Social coping, that's where we're kind of drawing on our friends and family to kind of help and support us. And there is that group that do avoidance coping, that they cope with what's happening to them by basically saying, this is a health issue, so it should be dealt with by the medics, and I will do what the medics say, but I'm not going to be proactive. I'm not going to go looking for information. I expect it to be done for me. And we have these, as I say, we have these 4 different coping mechanisms potentially. And then there are emotional reactions to the coping strategies. So for some, they work really well and there's a sense of content and it does work, you get contentment. But for some, it's actually quite stressful. Again, it can be quite anxiety provoking, and you can also get some frustration and anger because what you're doing doesn't seem to be working well. So one of the things we do with coping mechanisms is what we call appraisal. We try things out and see if it's working, see how it's going for us. Now, you might be wondering, what are those pictures of those like family groups in the middle? And that's because within families, you might have a patient who's the one that's being tested and been diagnosed with having a pituitary condition, but each of those individuals exists within a system. And that system involves other family members. So it could be parents, it could be siblings, it could be partner, it could be children. And each of those individuals will have thoughts and reactions. So when you tell them that you've got a pituitary condition, this sort of stuff, the representation of that health threat and what that means might start going through their head. And when you start getting towards the kind of coping with the surgery and the kind of late effects and those kinds of things, all the different members of the family are all going to cope with that in different ways, and they're all going to have different emotional reactions to coping. So this is completely different to having an acute condition like flu, where we all know what's happening and how it's supposed to go. There's a script we're all following. We all know what the script looks like. With this, we don't. It's all over the map. And that's partly why people find it really difficult, because everyone's doing different things at different points in time. And some of the understandings of it and some of the coping about it, people can be very passionate that their way is the right way. And if you're not doing it that way, then you're doing it wrong. Which brings us to the process of adjustment. If you have a chronic condition, it's going to be going on for months and years. How do you adjust to that? Now, we used to do this slide and it was nice, neat blocks, and they all had little arrows going from one to the other. But in actual fact, I just said with the previous slide, it's all over the shop. Well, it is with this as well. That process of adjustment, some people will find being diagnosed with a tumour is shocking. They may not necessarily experience the shock at the time when they're given the diagnosis. They may get delayed shock. Other family members may react with shock as well. They also may get delayed shock. You have emotional fallout and reactions too, which we've just been talking about. And then there's this other stuff, understanding what's going on, understanding the change and what that means. Potentially grieving for things that you've lost. The ways in which you're changing. So, for example, if your fertility is affected and now it turns out you hadn't completed your family, or you hadn't even started having your family, and now that's been taken away from you, that can be profoundly difficult for people. Kind of reframing and understanding what's happening and how do you make sense of it. Having some sense of acceptance that this is how things are now. Or in some cases, a sense of resignation. You kind of feel like you've been steamrolled by events and you don't feel like you have any control or agency anymore. And this is kind of all over the place because you don't go through these in a neat and tidy fashion. You bounce around between them, and that's true for all of the people, not just the patient, but for the family members as well. It's actually a really complicated process, and there's all of this stuff going on. So in summary of the kind of acute versus chronic health conditions, with chronic health conditions, you have a series of events. So you have the symptoms, you have the diagnosis, you have the surgery that kickstarts a process. That process is a marathon, it is not a sprint. So as I say, we're talking months and years. Chronic conditions involve treatment, it's not about cure. There will be regular checkups. And there may well be worries and concerns between appointments and things that people get anxious about and want to and need to discuss. I think one of the problems potentially with chronic health conditions is that with pituitary conditions where you have surgery, the doctor may well say, "Oh, you'll be better from the operation in a couple of weeks," but what the doctor means by that, as in the bandages will be off and the wound will be healing up nicely, etc., and what the person who's having the surgery or had the surgery hears. They might think what the doctor's saying to them is, you'll get better, is synonymous. It means the same as you'll be back to how you were before. And no one will be able to tell that you've had the condition, it will all be fine. But actually, that's probably not what the doctor means. So doctors use phrases like you'll get better, doesn't necessarily mean what we think it means. And that can be part of where the confusion comes from. So you as a patient in best will in the world, you will pass on what your surgeon or your doctor has said. And then people can kind of say, well, your doctor said that you'd be better, but you're not better. It's kind of like, what's going wrong? Are you lying? Are you swinging the lead? Are you? And chronic conditions generally are things that require monitoring and adjustment. The only discourse we have in our society about long-term conditions are cancer related, and this idea that you battle and fight cancer. Although I have to say that there's a kind of pushback in evidence now, with a lot of people saying actually you don't battle cancer. It's not a good way of thinking about how people manage and deal with having cancer. So a chronic condition is something that requires monitoring and adjustment. It's not something you battle and fight. It doesn't work that way. So those are the difficulties. In terms of what can we do, how can we communicate with our loved ones? Pituitary Foundation has lots of really, really useful information about various conditions. It can help you to explain what you're trying to say at work or at school, or indeed for doctor's appointments, because actually it can be really, really hard to navigate those as well when you've got a pituitary condition. One thing I would say is to take your time. These aren't necessarily communications that can be done quickly, and you may need to do them more than once. So something might be playing on your mind and you're thinking about it a lot, but your family members may well be thinking about other things and their focus may be on other places. And so for them, when you're trying to talk to them, it's kind of you may well need to kind of have the conversation more than once in order to get the message across. And you may well need to take your time in order to prepare, so you have some sense of what it is you're trying to achieve by having the communication. It's okay to choose who you tell. In our friendship group, there is one guy, he's absolutely lovely, but whatever happens, whoever the event is happening to, so like when my husband had his stroke, other people in our friendship group told this particular person, because when you tell him anything, it ends up all being about him, his reaction, how he's feeling. And he's lovely, and he does get over it, and he's very supportive and very kind. But his initial reaction to it is always too difficult for the people who are dealing with whatever it is they're dealing with, whether that's sickness or bereavement or whatever. So it's okay. There can be reasons why there are certain people who are difficult for you to communicate with, and you need a proxy, you need someone else to do it for you. If it's possible, choosing your time so that everyone's in the best possible frame of mind. At the end of the day, when you're all knackered, is not a good time to be having difficult conversations. Some of us are larks, some of us are owls. I'm a lark, my husband's an owl, so I'm better functioning first thing in the morning. Mornings are really not his thing. So we do our important communications in the afternoons, because our energy levels are at matching point, and we can communicate most effectively then. If you can, sitting side by side or walking side by side actually is a better way to have the communications. It's less confrontational, and it's easier for people to have difficult conversations in that particular formation. Trying to use positive statements to identify what it is you'd like to see as an outcome. So dwelling on what you don't want can lead to confusion. So in school, for example, if you have the kids in the corridor, the teachers that say to them, walk, what they don't say to the students is don't run. Because if you say don't run, the brain hears run and they just go faster. So you don't mention what you don't want them to do. You focus on what you do want them to do. You want them to walk. So that's the magic word. You say walk. When we come to having chronic health condition, these are useful questions to think about in terms of preparing, because these two things are very, very different. We talk about families and we talk about caring, and we kind of talk about care and support, and social care and social support, and we assume that families should and could do it, and there's quite a lot of judgment about families where family members find it a difficult thing to do. But caring about someone is very, very different than caring for someone. So caring about them, loving them and wanting to understand them is very different than being willing and able to help them and step in with practical stuff, whatever it might be that they need doing. So you need to be kind of thinking about, what is it? Do I want someone just to listen to me and to understand what I'm experiencing, and for them to actually express that they understand and they get it and they're in my corner? Or do you want them to do some practical things because you need some help around being able to do activities of daily living? So you need some help and support because mornings aren't good, because your first lot of medication doesn't kick in so quickly. So actually getting the kids up for school is it's going into the too difficult box, and so you need to have some negotiation about how those things are going to happen. Or actually, do you need a mix of the two? Are you asking for both things? In terms of communicating assertively, assertiveness is actually not about imposing what you want on someone else. Assertiveness is very much about maintaining a functional relationship. So it's based on the idea that you need to take responsibility for how you're feeling and be able to accept and hear that someone else may be feeling differently to you. And that kind of relates back to all that stuff I was just saying about why it's so difficult. People being all over the map, having different preferences in terms of when it comes to coping. So you, as the patient, might be very keen on having lots of information, but your partner really might not. Avoidance coping might be their preferred option, and that can cause some tension. You need to accept that even having heard you, the other person may not be able to respond to your communication or meet your needs right now, which is why I say take your time and do it slowly in pieces as and when you need to. You may need to check that the other person understands what you're saying, so you can ask them to repeat back what it is that you think you're trying to communicate, and then clarify any bits that seem to be misunderstood. And we use words in different ways, and some words like pituitary and what the pituitary is and what it does, that can be really confusing for people, and then you may need to do it more than once in order for them to kind of do the necessary learning. You might think that actually, if you use some colourful language, and I don't mean swearing, I mean things like exaggerating, you might think actually, well, if I kind of lay it on with a trowel, that might get through better. But actually, what you do when you exaggerate is stress both yourself in describing it that way and the individual that you're trying to talk to. So exaggeration as a strategy doesn't work in terms of communicating how important something is. And you may need to have several goes, because actually it's not an easy thing to do. There's a lot of finger wagging goes on. You always, you never. That's kind of getting away from that and having constructive conversations can be a bit tricky. Other things that help, being resilient. So the idea of being able to bounce back ability. And developing tolerance, having and developing problem-solving skills, because actually those can be important when you've got chronic health conditions. Seeking social support, having social support. It's not always possible for your family to be able to provide, or for them to be able to do all of the listening that you may need them to do, and so the Pituitary Foundation has got local support groups, it's got telephone helpline bodies and such, where you can get that assistance if you need it. If your family can't listen to you, then there are others who can and will. Being willing to seek help, again, the foundation is brilliant in terms of its information. The kind of endocrine nurse helpline, if you're confused about medication, that kind of thing. Believing that there's something that we can do to manage our feelings and cope, the idea that we are survivors rather than victims of circumstance, having an attitude, what's now been dubbed the attitude of gratitude, and being able to recognise that there are still those little gleams of sunshine in your day, even though it's still really difficult, those things are still there. This one is really important, being able to forgive ourselves and other people when mistakes are made, because living with a chronic condition is so complicated. it's inevitable there are going to be some mistakes, some misunderstandings, and we need to forgive ourselves and other people. They're not doing it to be horrible, they're doing it because they're human, and humans don't do perfect. Being able to help others, so trying to find some way of having some balance can be really important. Finding some meaning, and that can be important for all of the family network that's caught up in this. Kind of stories we tell about ourselves and experiences, and you'll see those if you read Pit Life, the magazine for the foundation. You will see people's stories and how they're doing that, how they're finding meaning in those stories, and trying to make sure that not every single communication you have is always about your health. So trying to find things that you can do with those people that you care for that's got nothing to do with your condition. So with my husband's stroke, for example, he's a huge fan of Red Dwarf. So we can have conversations about Red Dwarf and fun things around that and walking and what have you that aren't about the condition. So there's some balance there. It's not always about that one thing. So there you go. That's the end of the presentation. I think I've actually brought it in on time for once. So thank